Hi everyone, here is your video for today, and today we will be talking about HRT. I want to show you what it looks like and what you can expect. I'm literally just recovering from a cold, which I've been taking my vitamins for, so don't forget to take your vitamins. I'll show you that later, but my vitamin C has been absolutely amazing during this time. Yeah, but it's just some kind of cold and cough going around Lagos that's been so awful. You can still hear it from my voice. But yeah, feeling a little bit better today. But I said we must talk about hormone replacement and what we call menopausal hormonal therapy, hormone replacement therapy. You can call it whatever you want. It's not very popular in Nigeria, and I think it's not popular because of various things, because of the myth surrounding it, also the studies from the past that associated HRT with an increase in the incidence of cancer, and also there's a cultural sort of reason. You're expected to go through it with grace, go through menopause with grace, just the same way our mothers did, and we just go through it, and it's okay to go through it because menopause itself is a change. Just like the way you have menarche and have your menstruation, menopause itself is also a life stage, and eventually those symptoms will pass. But we also know that it's associated with different risks. So you have a reduction in your estrogen. That means also that your bone density reduces. There's an increased predisposition to cardiac problems, coronary heart disease, and so many other symptoms of this life stage, apart from the active symptoms that you will get. Okay, anyway, let's get on with it. So HRT usually will comprise of estrogen and progesterone, and then there's also the we can add testosterone if the woman has symptoms that suggest low testosterone, and we can test that. So testosterone is an extra if the testosterone levels are low, but you would be able to test for that as well. I strongly recommend that you have estrogen and the progesterone separately, and that you have the estrogen as a topical, so either as a spray or as a cream rather than as a tablet. But that's also available. You can also have tablets, but I feel that the risks for any complications are way lower if you have estrogen as an extra, so as a cream or as a spray. So today I'm going to be showing you this. I'm not affiliated with this brand in any way. This is just one of the brands, which is a spray, and I'm going to be unboxing it for you and showing you what it's like. So this is an estrogen spray, and it's super easy to use. So this is a box that will be enough for about 3 months, and then this is just the one of the boxes inside it. And so let's open it, and then you have the spray in there. Okay, so that's Lenzetto spray, and that's how it comes. Very, very easy to use, and you can spray that anywhere, right? So you can keep it at room temperature. You don't need to freeze it or anything, and you just spray it. Okay, you just spray it on your skin, spray it anywhere there, and make sure it dries and rub it in. And you can have different numbers of sprays. It just depends on what you start with. But I always say start with the lowest dose first. So this is what it looks like, and see how so easy to use. And this is the estrogen spray. There's a gel as well, but this is so much more easier to use. I'm sure you can see what this looks like. So that's your estrogen spray. But we know that if you have your uterus, that means if your womb is still in place, you haven't had that removed, then you must protect that. Because if you have only estrogen, then what will happen is that the lining of the womb will get thicker and thicker, and that can predispose to cancer of the lining of the womb. So we want to make sure that lining of the womb is thin all the time. And the way we do that is by giving you progesterone. And this progesterone is the natural, the most biosimilar progesterone on the market. This is the only one that we have, and this is called utrogestan. There's different schools of thought about taking it cyclically or taking it continuously. I recommend taking it continuously, and just take 1 or 2 tablets depending on what your provider advises every day, all the time. That way you know that your womb, your uterus is protected, and you're fine. So that's 1 sachet. That's 1 blister pack, and inside it there are 2 blister packs, and each one is just 100 milligrams. So yeah, 100 milligrams, and usually, depending, you can take 1 tablet daily or 2. Again, it depends on your provider. This is getting to be a very long video. I wasn't thinking it was going to be long, so I may have to have a part 2. But this is what your natural, the most similar progesterone looks like, and you take that every day. I mean, women who have optimized their HRT report they feel so much better. I'm telling you, I'll see a woman whose life is imploding because of menopausal symptoms, and I see her 3 months later, and she's a different person. Her skin is glowing, her hair is growing, she's feeling so much better. Her libido is normal again. She's living her best life. So I'm not saying that you must take HRT, but if you want to take HRT, this is the best way to go about it. So having it as estrogen separately, as a cream or as a spray, and then having your progesterone daily to protect your uterus. And then finally, just the extra bit, which is the testosterone, because some women report, really low energy levels, very low libido, very low drive, and then we find out that the testosterone levels pretty low, pretty low, maybe way below 1. For a woman, you want it to be around that 1 level. And if it's really, really low and you're feeling that way, then some people have pellets, which they embed in their skin, or you can just have testosterone gel, which is a little bit more difficult to sort of dose. But yeah, this is what it comes like. This is a box of testosterone gel, and it has different little sachets inside it, and you just use 1 at a time. But this is not for everyone. This is a transdermal gel. You rub it in your skin as well. It's not for everyone. You have to discuss this with your provider. Okay, so that's a long lesson today on hormone replacement therapy. I hope you found that helpful. If you have any questions, please just send me a message, or just book a consultation and come and see me if you're in Lagos. It would be amazing to see you. Or to be honest, even if you're in London as well, we're more than happy to see you and discuss HRT all day long. And also, I even want to talk to organizations as well, companies, particularly who have women in this phase of life, because women around this age, around the 50s, late 40s, 50s, are when that's the pinnacle of your career. And this is a time for organizations to really support women at this phase of life. You don't have to have HRT. There are other things conservatively that we can do. So invite me to your company. Let's come and have a chat about it. All right, that's your lesson for today. Bye.